So when a runner presents to our sports chiropractic clinic with Achilles tendonitis or Achilles tendinopathy, oftentimes what we'll see is more of a pes cavus foot type, a rather rigid lever. And what that suggests is that they have a little bit of difficulties with their ability to absorb forces. And oftentimes it puts them, they have limited ability to flatten their foot or pronate their foot. So they kind of go into an early heel rise. Um, and what you'll see is like their ability, they'll go up on their toe, and that's obviously very much similar to repetitively calf or heel raise, and that will overload the Achilles tendon. So there's a couple different types of Achilles tendonitis, more of like a insertional, like lower to the heel, and then like a mid portion kind of up the Achilles tendon. That's typically what we see. So the examination a lot of times will focus on improving the ability of their foot and ankle to pronate or move, to get it out of that pes cavus foot type, make it a little bit more of a mobile adapter, and then we're going to try to cool off the tendon using isometrics exercise where we just kind of do static holds just near the painful range, or we do eccentrics where we let that heel actually go below the forefoot. And then thirdly, this is a great condition for shockwave therapy. So we can actually cool off kind of that mid portion. Occasionally we'll do some tape. Occasionally we'll play around with orthotics, not too often. A heel lift can like offload that tendon a little bit while we kind of stay on plan, but we have to kind of tidy up the gait, right? Make sure we're not going to that premature heel rise, and then do some of this stuff over here. So I'll show you what that looks like. So some of the tools that we use, if we want to focus on like making that foot a little bit better mobile adapter, we do these functional reaches. So if I'm treating my left foot, trying to get it to flatten, I have patients kind of grab a furniture slider and do a functional reach where we're bending our lower left side over the foot. We're really focusing on letting that arch kind of collapse. This looks like a little bit of a calf stretch, right? We're stretching our calf. We have a knee bent, so it's maybe targeting soleus a little bit more rather than gastroc, but we're really kind of focusing here, and I'll actually kind of provide a doctor overpressure on this exercise, is I'm driving that midfoot down. I'm getting some mobility in that rear foot, kind of that subtalar joint. It's supposed to evert. Eversion is one of the motions that is needed in pronation. So we're trying to get rid of some of that tension. We're reaching out at a 45, and then we're reaching back here. So these are a great way to kind of make that foot a better mobile adapter. I think this is an effective exercise to get runners with Achilles tendonitis doing. That's one way to kind of make the foot, like basically unloading the Achilles tendon. And then, like I said, we kind of take a little bit of a step, and we can do isometrics. Both, we start with 2 feet, just kind of just at that painful range. A lot of times as we go lower, start to get into that eccentric, patients get a little bit more sensitive. This is a good way to kind of stretch the calves, kind of build up some resiliency, and then we just kind of do iso holds here. What you'll see is like as runners, the progression up with 2, a lot of times I'll go nice, slow, and controlled down with 1, up with 2, down with 1 on the affected side, really, really slow, kind of a 5-second down. And then the idea is we're able to eventually build up some robustness in that tendon as it cools off, maybe with some exercise, some shockwave, obviously adjusting to the foot and ankle, so that now we can kind of strengthen and maintain that range of motion. So it's kind of a multifaceted approach to cooling off that Achilles tendonitis or that tendinopathy.